Followed by that are blood pressure recording. So, as said earlier, a sphygmomanometer is an is a measurement device which is commonly used to identify the blood pressure values. So, we have to measure two different values, systolic and asystolic blood pressure. That is the contraction and relaxation of our heart. In layman perspective, the sound of lub and dub will be measured individually. That is what gives us the 120 bar 80, right? So that's what we find. So the value will be denoted by the rise of the mercury in the manometer or the thin tube. So it will help us identify what is the value it is at, and also at what point of time we can measure the systolic rhythm and also diastolic time. We can identify both these sounds and then identify the particular reading at that particular point in time. Then we have orthostatic measuring. So these assesses vital signs that changes with lying or standing conditions. It will help us find out hypovolemia, orthostatic hypertension risks, and so on. Uh, then we have continuous surveillance. So it is critical to identify the cardiovascular disease management, and it is very important to identify them earlier so that it does not deteriorate over time. So we also have to identify the hemodynamics instability, as in the dynamic variations of our blood pressure and so on. Then we have the respiratory rate. Uh, so this is often a very neglected vital sign. Even the person who is breathing, we do not consciously, we do not identify that, or we do not just feel it. So only when we are consciously monitoring our respiratory rate, only then we can identify any changes or if there is any abnormality or so on. So what they do is clinical deterioration indicator would be like if we have like more than the if 25 19 to 25 breaths per minute. If it is more than that, then it might be some respiratory stress related problem, and it requires immediate attention. Similarly, respiratory sinus arrhythmia is nothing but heart rate varies naturally with our breathing cycles. So we can actually reduce or increase our heart rate based on our breath or vice versa. So having a pulse on the pulmonary efficiency and coupling mechanisms would can be enhanced by using the respiratory vital signs checking. Then the mortality predictor is elevated respiratory rates about like 27 breaths per minute. It can be linked to high mortality in pneumonia or COVID-19 patients, making it a critical indicator. So what this says is nothing but when you're breathing so fast, it can be a sign that you're not getting enough oxygen. So when not getting enough oxygen, your brain might it might not have enough oxygen to sustain, and it might start to lose some. The brain cells might start to die as well. So this is a typical indicating scenario for the people who are about to die of pneumonia or COVID-19. And we have like documentation gap where uh, even if we know that respiratory signs are like important, it is often under-recorded, and it can be also taken. It cannot be. It can be like not documented, and it can be a cause for an oversight. Then we have advanced respiratory measurement systems that we have like now we have like wearables, right? So from spirometry to wearables. So first thing is the direct measurement method like spirometry. So measure it. What it does is it measures respiratory gases during exercise. So what will happen is the patient will be asked to run on a treadmill, and their vitals, as in the oxygen levels, carbon dioxide levels, their chest compressions, as in the compression and rarefaction of the chest due to lungs expanding and contracting, and the oxygen value, carbon dioxide value, inhaled and exhaled gas values, the pulmonary, cardiac, and cardiovascular, all these details will be recorded to give us a good sense of our respiratory health, let's say, respiratory and cardiovascular health. So this would be done only when patient is like obese or they are having some, they are suspected of having some of the symptoms with respect to like respiratory or cardiovascular problems. So, but this is only when we are prescribed with a clinical requirement. But what we can do is we can have like indirect test methods like stress testing, bicycle test, stress test, endurance, all of these things can be done just as an indirect method or unofficial methods as I said.